So a lot of people want to know, what is a Pap smear? Why do we do Pap smears? Is a Pap smear something that's the same as just getting an exam? Tell me all about a Pap smear. I'll tell you a little bit about Pap screening. So Pap screening is named after the person who invented it, Dr. Papa. So we shorten it to Pap. And smear, the name comes from the old-fashioned way of looking at cells smeared on a microscope slide. And Pap screening really is cervical cancer screening. So the cervix is the lower part of the uterus that opens when a baby is born. And it is susceptible to cancer like other parts of the body. But one of the cool things about Pap testing is it's one of the things we can do to prevent cervical cancer. So cervical cancer comes from exposure to a virus called HPV, or human papillomavirus, and it's everywhere in the world, and we can get exposed to HPV and it can cause changes to the cervix that can then turn into cancer later on. And so Pap smears collect cells from the surface of the cervix with a little brush. It's kind of like a little paintbrush, and we look at those cells under the microscope and we can say, are those cells normal, or do those cells look like they could have some changes that make them at risk for turning into cancer in the future? And this is one of the ways that we can prevent cervical cancer, or if heaven forbid somebody had the beginnings of cervical cancer, we would be able to detect it. It's better always to prevent cancer rather than wait until it's already happening, right? A lot of people think, oh, as soon as I become sexually active or as soon as I'm a teenager, I should get a Pap smear. That's not true. We actually wait until age 21 to start doing Pap smears. And the reason for that is that our immune system when we're teenagers is so strong and so good that it's so good at recognizing those abnormal cells and the HPV virus and getting rid of them. And so at age 21 is when we recommend doing Pap testing. Another myth or misconception that's out there is that we need to do Pap tests every year. So this is how we used to do it. You needed to do your visit every year, you did your Pap smear every year. Now we know more about how cervical cancer progresses and how those changes can turn into cervical cancer and how long that process takes. And we actually need to do Pap testing every 3 to 5 years. And so that doesn't mean you don't ever go to your provider every year, but go for your provider every year. But it might be one of the years we need to do a Pap test. It might be another year that you're due for a different immunization, but that's how often we need to do Pap testing. Another thing that we can do, depending on how old you are and your risk factors, is testing for that virus, HPV, that I talked about. HPV is one of the viruses that we actually have a vaccine for. So many of us have been vaccinated when we were younger, age 11 or 12. And this is a cancer prevention vaccine. It's the 3-shot series, but it's effective if you get it all the way up until our mid 40s. So if you didn't get that vaccine as a kid, we recommend getting that vaccine. And that's the other part of our cervical prevention strategy is get vaccinated against HPV that can cause those changes, and then get regular Pap testing, which can prevent cervical cancer.